iSPARC is the Implementation Science and Practice Advances Research Center that is located in the Department of Psychiatry at UMass Chan Medical School here in Worcester, Massachusetts. We are a research center of excellence for the Department of Mental Health for the state of Massachusetts. The work of iSPARC is focused on conducting research that benefits people who have a serious mental health condition, as well as the people who in programs that are trying to provide services that support them in their lives.
The Department of Mental Health in Massachusetts is really amazing and is a wonderful partner to the UMass Chan School of Medicine as well as the Department of Psychiatry. It's also been a pivotal partner for iSPARC. It really has the scaffolding that iSPARC needs to be successful because DMH is really focused on individuals who have severe and persistent mental illness or lifelong illnesses. And that is really where iSPARC is in many, many instances, trying to make the lives of the same stakeholder group that DMH focuses on and we focus on better, ultimately, through a variety of interventions.
So the mission of DMH, the Department of Mental Health here in Massachusetts, is to make sure that all the citizens in our Commonwealth have access to effective behavioral health treatments. And we do that by supporting research, development of new practices, and ensuring that the practices that are out there for patients that are needing help behaviorally are effective and efficient.
iSPARC has several key programs. The first and most fundamental to what we do is our program in public mental health and implementation research. We have investigators across a wide swath of topical areas within those domains. Most of our investigators have focused on a particularly vulnerable subpopulation of people who have mental health service and related needs. So, for example, we have a large program that focuses on individuals who are involved with the justice system. And those are individuals who can often be overlooked in terms of the needs for mental health treatment. We have programs for people who are deaf, for young people who are moving from adolescence into adulthood, which may not sound like a vulnerable subgroup, but in fact it is a group that tends to not be served well by our service systems because they sort of fall between the cracks of the children's systems and the adult systems. And they have very particular needs for how we reach them and engage them in services. And then we have just a variety of other sort of special populations, women who are essentially what we call perinatal. They're pregnant or having recently given birth who have mental health treatment needs. And so across those research programs, then people ask a wide variety of questions with their research about how to investigate or how to make studies and investigations that help us serve those populations better. Our other programs really make that research real, and that's in many ways why I think iSPARC has a particular strength in the field of mental health services research. Foremost among those is our Stakeholder engagement program, and that program really works with all of our investigators to ensure that their research is based in essentially the groups of individuals or people who represent programs and other kinds of services that would utilize what is learned from the research.
So there's a wide variety of ways that iSPARC helps to infuse the voices of those with lived experience of mental health conditions into the work that we do. So one of the biggest ways is to establish advisory boards of those with lived experience. So we have several advisory boards, one for adults, which I help to co-facilitate. So that's called iSPARC Insight. And that's really a group of individuals with lived mental health experience who are bringing their voices to bear on the research that we do. It's a really collaborative and exciting development. There are several other advisory boards serving, for example, youth and young adults, serving family members of those with mental health conditions.
So not only are these populations overlooked in mental health research and underserved in the behavioral health system, but also there are significant health disparities for these populations, and we often see higher rates of mental health problems and substance use disorders within these groups. Stakeholder engagement is especially important when working with individuals from marginalized groups, the people who are overlooked, underserved, especially when the researchers are coming from the majority population. So really, we're working in partnership with individuals from these communities so that the research we do aligns with their priorities, their values, their community norms. It's really about working in collaboration so that the research we do is not just about them, but by and for them.
Another sort of set of programs is our technical assistance and communication programs. And those are different mechanisms for trying to communicate and make useful the knowledge that we've gotten from the research that has been done. So at the front end, we have stakeholders who help ensure that the questions that we're asking with them are things that are important and relevant. And at the back end, we're then working to try to get the findings of that research out there to folks who can utilize it.
So one of the things that iSPARC does is offer what we call basic TA, or technical assistance, to the DMH workforce. And the DMH workforce is pretty broad in Massachusetts. There are providers and administrators, direct line staff, all the way up through central office of the Department of Mental Health.
And a really important technical assistance program that we have right now is to help the Department of Mental Health specifically around that implementation of good evidence-based implementation practices in their largest mental health programs, which are their adult community clinical services.
iSPARC is our cutting edge with implementation science. And because we're population-based and we care about everyone getting access to care, iSPARC is a great partner in implementing evidence-based practices to meet the needs of people in behavioral health crisis or behavioral health need. So that's our biggest partnership value.
We help them with everything from the hiring practices for who they're, the clinicians they're going to hire to carry out these evidence-based practices, to all the way through to coaching and supervision. How are they going to gather their data to make sure that it works? How are they going to evaluate that to make sure it works and tweak it on a regular basis? And so there's a number of steps that a lot of providers don't have time to be thinking about or doing, and so they tend to welcome and embrace getting technical assistance with that.
Knowledge translation is really important because while research is really important, research alone does not lead to practice and does not lead to innovation and effective change. We use a technique called participatory action research, which I've also dubbed as participatory action knowledge translation. And they both mean the same thing. It means that the people who are the end users, the people who are going to use that knowledge that is meaningful to them, are involved from the beginning, from the very beginning.
I think in many ways the achievements of iSPARC that I, as the director, I'm most proud of really has been bringing these other dimensions to what is often sort of a not accessible field. So to bring the stakeholder engagement, to bring the technical assistance, to really focus on communicating the findings of research to the folks who will use that knowledge and making it relevant to their lives. To be able to do our work with that framework is a tremendous achievement.
Shortly after I came to UMass, I recognized that iSPARC is an absolute jewel to the medical center and to my Department of Psychiatry. It contributes to research in a whole set of ways, but I think its mission is absolutely critical because iSPARC focuses on some of the individuals who have the greatest challenges in our society.